Hello students, in today's lecture we are going to discuss about the general effects of systematic exercise on respiratory system and cardiovascular system. Let's start with the A response of respiratory system to exercise. Consisting of a series of body parts including the lungs, diaphragm and nasal cavity, the respiratory system is responsible for transporting oxygen and carbon dioxide to and from the muscles and tissues. During exercise, the respiratory system increases to meet the demands of the working muscles. The respiratory system also uses the cardiovascular system, that is heart, blood and blood vessels to transport oxygen and carbon dioxide. Heart rate. During exercise, your adrenal gland increases production of adrenaline and noradrenaline that directly affects the heart and the ability to transport oxygen and carbon dioxide throughout the body. The hormones then directly influence the sympathetic nerves to stimulate the heart to beat stronger for increased stroke volume and faster for increased heart rate and an overall increase in the cardiac output. Oxygen transport. To meet the increasing oxygen demands from the working muscles, additional oxygen must be transported through the blood vessels. During exercise, the sympathetic nerve stimulates the veins to constrict to return more blood to the heart. This blood is carrying carbon dioxide from the muscles and can increase the total stroke volume of the heart by 30 to 40%. Respiratory rate. With an increased amount of oxygen and carbon dioxide transport, your respiratory rate, that is, the rate of breathing, also increases. This increase is also influenced by the sympathetic nerves stimulating the respiratory muscles to increase the rate of breathing. At rest, your respiratory rate is about 14 per minute, but can increase to 32 per minute during exercise. The increased respiration rate allows more oxygen to reach the lungs and blood to be delivered to the muscles. Long-term response. A long-term respiratory system response to exercise involves several physiological adaptations. These adaptations ultimately result in an increase in the overall efficiency of the respiratory system to gather, transport and deliver oxygen to the working muscles. The long-term respiratory function is commonly measured with a VO2 max test that calculates your body's ability for oxygen consumption during maximal exercise. Through exercise and training, the effectiveness of respiratory system and VO2 max improve. Now let's see what are the effects of exercise on human respiratory system. Short-term effects of exercise would be increased use of oxygen because muscles will require more oxygen in order to work. For heart to supply enough oxygen, it has to increase its rate and stroke volume, so cardiac output will be high enough for all the systems to get oxygen. Because body systems take oxygen and give carbon dioxide, lungs will have to work harder in order to remove carbon dioxide from blood and replace it with oxygen, so it will make the breathing rate higher than normal. Long-term effects of exercise would be increased capacity and effectiveness of lungs, faster gaseous exchange from carbon dioxide to oxygen. Body will be more efficient at using oxygen. Short-term effects of exercise. In respiratory system, there would be an increased breathing rate by about 3 times the normal rate. Increased amount of air taken in or out with each breath by 5 times than the normal rate. Increased blood supply to and through the lungs and an increased oxygen intake. Breathing rate returns to normal in 10 to 20 minutes being in rest mode. Long-term effects of exercise. For the lungs, you will have increased functional capacity during exercise, increased diffusion of respiratory gases, waste carbon dioxide exhaled from body, and increased vital capacity, that is the maximum amount of air a person can exhale from the lungs, which will decrease the debt of oxygen in blood while exercising. It also can prevent from lungs disease and be more resistant to dust and mites. By exposing body to regular exercise, especially cardio exercises that include running, you can increase cleaning process of lungs if you have been a smoker or working in dusty places. A very important muscle for lungs is diaphragm, which makes the air to be sucked into the lungs. By exercising, you increase the strength of diaphragm. Also increase in the number of capillaries that is surrounding the alveoli that makes the gaseous exchange process faster and more effective. Exercise. Effects on the respiratory system. Effects of physical activity and sports on the respiratory system mainly depends on changes in alveolar CO2 levels. Here, after analyzing the basics of oxygen transport, that is changes in CO2 and O2 concentrations in the blood and cells, we are going to provide a clear and simple answer to the following questions. What are the exact criteria that determine the long-term positive effects of exercise on overall health and well-being? Are these criteria different in healthy and sick people? If exercise is healthy, why do thousands of sick people die every year from coronary artery spasms, infarcts, strokes, exercise-induced asthma attacks, and many other acute diseases during or following physical exercise? Is graded exercise therapy useful for all patients? What is going on with the respiratory system of these people during exercise? What are the short-term and long-term effects of exercise on the respiratory system? Chronic diseases include heart diseases, diabetes, asthma, COPD, cystic fibrosis, cancer, and many others. Study hyperventilation syndrome for references and numbers. As it is easy to observe, heavy breathing at rest results in relatively heavy breathing during exercise, and that makes moderate or intensive exercise in sick people very difficult or impossible. This table shows that the people suffering from chronic diseases, minute ventilation is about 150 L per minute, whereas people in normal health conditions have 90 L per minute as their minute ventilation. But when it comes to super healthy people, it comes down to 30 L per minute. If you attend a typical mass running event or open marathon, you will notice numerous ambulances with paramedics who are ready to provide rescue, help and oxygen regardless of the details of the chronic diseases. For example, heart disease, stroke, seizures, exercise-induced asthma and so on. Whatever the condition, low brain and heart oxygen levels are the most likely physiological causes of possible deaths. Hence, the main questions then are, what are the factors that define effects of exercise on the respiratory system? What is going on with blood gases or oxygen or CO2 in the blood and body cells? The answers depend on the pre-existing respiratory parameters and levels of blood gases before and after exercise. Exercise and the respiratory system in healthy people. Consider the short-term effect of the exercise in the healthy people. Textbooks on exercise physiology suggest that in fit and healthy people, arterial CO2 levels rise slightly with light, moderate, medium and sub-maximum exercise intensity levels regardless of the route of breathing during exercise. Since carbon dioxide is the powerful vasodilation agent, expanded arteries and arterioles improve blood and oxygen delivery to all vital organs of the human body, including heart and brain. Vasodilation ensures aerobic respiration in body cells, making it possible for healthy people to enjoy all the benefits of aerobic exercise without any major problems related to tissue hypoxia causing excessive blood lactate, muscle spasms, injuries, low recovery rates, overexcitement, stress, poor sleep, etc. Hence, healthy people experience immediate positive effects of exercise on the respiratory system and blood gases. What happens after exercise? The long-term effects of exercise on the respiratory system. Since breathing is controlled by carbon dioxide, the usual exercise effects for fit and healthy people are simple. Breathing after exercise becomes lighter and slower due to an adaptation of the respiratory system and the breathing center to higher carbon dioxide levels. As a result, the body oxygen content increases for many hours after the exercise. This especially relates to the next morning body oxygenation, and this is the main criterion of exercise efficiency if someone decides to measure the exact long-term effects of exercise on the respiratory system. However, when very healthy and healthy people do exercise with strictly nasal breathing, their blood gases during exercise are different in comparison with mouth breathing. Arterial carbon dioxide gets even higher and arterial oxygen saturation becomes slightly less in a dose dependent manner. Nasal breathing in and out slightly worsen the immediate performance and result, but is comparably better in the long run. Why? Intermittent hypoxic hypercapnic training, as in case of nose breathing, is an excellent way to improve VO2 max, body oxygen content, and achieve adaptation of the breathing center to higher carbon dioxide. VO2 max definition: the maximal oxygen uptake or the maximum volume of oxygen that can be utilized by the human body in 1 minute during maximal exercise. This is measured as milliliters of oxygen used in 1 minute per kilogram of body weight. VO2 max is usually ranged from 20 to 40 ml per kilogram per minute and up to 80 to 90 milliliters per mg per minute in elite endurance athletes. Physiologically, it is the most significant parameter that predicts long-term endurance and performance in athletes. One can try both these approaches, that is, reduced nasal breathing on some days and heavy mouth breathing in others, and compare the effects of both types of exercise on your well-being. It is, for example, easy to discover that physical exercise with strictly nose breathing significantly reduces pulse for the same intensity level for many particular individuals in comparison with mouth or combined breathing. Hence, the positive effects of physical exercise with nasal breathing only are immediate. They can be easily measured with sport watches and other devices that can record heart rate during exercise. Exercise and the respiratory system in sick people. As analyzed before, over 40 medical studies that measured breathing in the groups of sick people have heavy and deep breathing at rest before exercise. Hence, they have abnormal blood gases prior to exercise. Usually, they suffer from arterial hypocapnia, that is, low carbon dioxide due to overbreathing, and likely mild arterial hypoxia if they are chest breathers. Chest breathing, as we discussed, reduces oxygen level in the arterial blood. If they have problems with their lungs or ventilation perfusion mismatch, as in a small group of patients with severe asthma, bronchitis or emphysema, their arterial CO2 is high, but blood oxygenation is low, already at rest, causing dyspnea, that is, shortage of breath sensation, even during low intensity exercise. Overbreathing at rest reduces their body oxygen levels. As a result, many people with diabetes, cancer, heart diseases, chronic fatigue and many other conditions have elevated blood lactate level at rest, indicating the presence of cell hypoxia and anaerobic cellular respiration. Mild exercise generates even more lactic acid due to initial oxygen deficiency. This is a common reason why the sick people do not like exercise. As a result, since the lactic acid level is also controlled by the respiratory system, the body starts to remove bicarbonates from the blood by increased ventilation. To maintain blood pH in the normal range, the breathing center intensifies minute ventilation to remove some carbon dioxide from the body. The breathing becomes disproportionately heavier. The main short-term effect of the exercise in sick. This is possible to observe in many sick people during exercise. Heavy panting, usually through the wide open mouth. Mouth breathing, as we have previously discussed, further reduces the arterial and cellular CO2, creating brain hypoxia and increasing heart rate. Nasal breathing, on the other hand, prevents CO2 and nasal NO loses and improves brain and heart oxygen content, provided that the intensity of exercise is matches oxygen delivery. The overbreathing caused by mouth breathing during exercise can continue for many hours after exercise if it is too intensive and anaerobic. Exercise with low intensities are better tolerated, but mouth breathing still negates any improvements in heart and body oxygen level, cancelling positive long-term effects of exercise on the respiratory system. It is normal then that the severely sick individuals can easily die due to moderate or intensive exercise combined with other hyperventilation inducing lifestyle factors including stress, overheating, overeating before exercise, drop in blood glucose level, chest breathing, etc. It is not a surprise that the graded exercise therapy has also conflicting results so far. There are many coaches and fitness instructors these days who teach their athletes, students and pupils to breathe in through nose and out through mouth in order to improve the long-term effects of exercise on the respiratory system. This breathing technique for physical exercise is half better than mouth breathing due to improved absorption of nitric oxide and some increase in arterial carbon dioxide. Conclusion: the effects of exercise on the respiratory system and body oxygen content in the sick are generally negative due to mouth breathing. There are, however, some positive effects of exercise due to perspiration, shaking of body, stimulation of respiratory muscles and lungs, production of endorphins and others. So dear students, today we learnt about the general effects of exercise on respiratory system and cardiovascular system. This is all in the chapter. Hope to see you again in the next lecture. Till then, goodbye. Thank you.